Welcome, this is Fauzi Maluf Filho, Associate Editor for Gastrointestinal Endoscopy, and today we are privileged to have here Dr. Joshua Melson from Rush University Medical Center, Chicago, Illinois, to discuss the recently accepted manuscript entitled Radiographic Staging Practice of Newly Diagnosed Colorectal Cancer Vary According to Medical Specialty. Welcome, Dr. Melson. Thank you for joining us today.
Thanks for having me.
Could you give us some background of why did you choose this topic?
Yeah, so I chose this topic because I saw in clinical practice that many newly diagnosed patients with colorectal cancer were coming to a multidisciplinary cancer center with staging that had omitted CT scanning of the chest. That is, they got an abdomen and pelvis without the chest. So I was interested in looking at that further.
And could you briefly summarize the main findings of your research?
Sure. So what we did was we looked at newly diagnosed patients with colorectal cancer that were diagnosed at colonoscopy. And first we looked at who actually ordered the staging, whether it was done by the gastroenterologist who completed the colonoscopy or some other provider, perhaps an oncologist or a surgeon that they might have referred. And then we looked at the staging practice. In 2008, the NCCN adopted a clear recommendation that CT of the chest, abdomen, and pelvis should be incorporated as the initial radiographic staging. And we wanted to look at compliance with that.
Perfect. And could you discuss on the reasons why gastroenterologists had lower rates of chest CT incorporation colorectal cancer preoperative staging?
Yeah, so what we found was that the majority of the colorectal cancers were initially staged by the gastroenterologist who performed the procedure, about close to 2/3 of the cases. This came from over 55 hospitals that the physicians came from. And what we found, though, was while the gastroenterologist ordered the majority of the staging, they actually staged, they omitted the CT scan. That is, they were not adherent with guidelines more frequently than non-gastroenterologists. We thought that was interesting, that those who perform the most staging are actually not as adherent as the ones who perform less staging.
Yes, and in your opinion, why did it happen?
Well, that's a good question of why this, why that happens. Perhaps it has to do with a lack of knowledge of the guidelines. There aren't staging guidelines clearly specified in our GI societies. Perhaps they should be. It may be a lack of knowledge. It may be that there's a desire to initiate staging but not complete it. I think that that's counterproductive, because what will happen is that we saw this many times, is that then when the patients are referred to the oncologists and the surgeons who tend to be more adherent with the guidelines, they will then resend the patients for further imaging, get the CT scan of the chest, and this isn't an efficient way to be staging patients who are newly diagnosed.
Yes, sure. And in your opinion, how could we improve the adherence of gastroenterologists to the colorectal cancer staging procedures?
Sure. Well, we didn't look into that, and that would definitely be the next step. I think one would be to educate and make gastroenterologists more aware of staging practices. Second would be perhaps to give feedback as to what their actual staging practices are. It was interesting, we noticed that there were a number of variables that seemed to correlate with whether the gastroenterologist would order a pan-CT that is inclusive of the chest, such as if the tumor was in the rectum, they were more likely to order it. If it was an obstructive lesion for some reason, they were more likely to order it. So it appears that there's a lot of variation amongst gastroenterologists, even within the same gastroenterologist, of their staging practices, and to make that more adherent and more universal, I think, would be a worthwhile initiative.
Okay. And do you believe that this non-compliance phenomenon also occurs in the setting of esophageal cancer, gastric cancer staging? Would it be advisable to reproduce your methodology or study for GI cancers in general?
Yeah, I think that would be interesting. We would then get a more comprehensive look at staging practices. The NCCN and others have also recommended CT of the chest as well as of the abdomen in stomach cancers, for instance, and it's unclear as to whether that practice is being adhered to or not. That would be interesting to look at.
Okay. So thank you, Dr. Melson, for sharing your time with us, sharing your experience with us, and I encourage you to visit GIE website to watch this interview.
Great. Thank you very much.
Thank you.